Hello, I'm Dr. Williams. Over the next several minutes or so, I'd like to discuss with you some of the new concepts that we have about facial aging and some of the newer and very exciting techniques that we have to improve the aging appearance of the face. My job as your plastic surgeon is to restore you to a more youthful, healthy look and not have the long gone, windswept appearance to the telltale facelift. Now, we certainly can all recognize the difference between the very youthful face and that of the aging face. The big question is, what happened? What happened here? Well, when we initially, years ago, did facelifts, we always thought that, well, one of the major problems about this was that the skin had become lax and developed sagging and drooping. But more recently, what we've recognized is that there actually is an overall deflation of the face from a fullness in that seen in youth and a deflated loss of volume in the aging face. And it's often been said, well, the face of youth is like that of a full, ripe grape, while that of the aging face is that of a raisin. And so we want to know, what are the causes of this? What happened here between youth and aging? So we know that it's not only just the skin. And what we've learned over the years is that the skin is attached to the underlying deep tissue. And as the deep tissue ages, becomes lax, it pulls down the skin along with it. So although we initially felt that the major problem with facial aging was the laxity and the sagging appearance of the skin, we've come to recently recognize that the problem is much deeper than that. In fact, the problem is with the deep tissue of the face and neck. And as we've shown here, the deep tissue of the face has developed a laxity and sagging appearance, and with that has pulled the skin down so that we have now the development of jowling and drooping of the lower cheek area, the development of what we call nasolabial and marionette lines, as well as a sagging appearance of the mid-face and lower eyelid. In addition to that, we also have the development of neck bands that extend from the chin down to the mid-neck, and that is due to the separation of the muscles of the neck and a sagging appearance of the muscles of the neck. So now what we recognize is that we want to resuspend and re-elevate the soft tissue structures in the deep portion of the face, and along with that, re-elevate and redrape the skin to give a more youthful and a more natural appearance. There have been several methods to achieve that goal. The major thing is that we want to resuture the soft tissue in this lower mid-face area and elevate that. And the newest technique involves the placement of multiple sutures throughout the mid and lower face, and then anchor this to the temporal bone and temporal muscle. And the reason why that is done is that prior to that, we have been suturing the deep tissue to itself. But this newer technique gives a more lasting result. In addition to that, in the neck, we suture the separated muscle bands of the neck. We then divide this muscle below that and then suture that muscle to the deeper fascia in the neck. And many people ask, well, why do you want to divide these bands here? Well, we want to divide them so that when we suture this muscle can then be elevated and resuspended in an upward direction. If we didn't, this would still create a band in the mid-lower neck. Many of you have seen on TV ads for Juvederm or possibly Sculptra. Now these are called injectable soft tissue fillers. They come in a syringe. They're a manufactured product that is to replace the soft tissue loss of the face. An alternative to that is the use of fat injection. More recently, there has been a tremendous amount of research and interest in fat injection. We can harvest fat from the abdomen or the thighs and then inject that into the areas of loss of volume, and particularly that in the what we call nasolabial marionette lines. In other words, that area of depression in the lateral mouth area, and also in the cheek and portions of the lower eyelid areas. The advantage of fat certainly is that it is your own body's tissue. It's natural, it is soft, and we can usually take almost as much as we want. The fat is injected with a small syringe and a blunt needle. It is done at the same time or can be done separately from the face or neck lift. And it appears that the fat actually replaces your own loss of fat in these areas. And that then, along with the lift and the resuspension and the re-anchoring of your soft tissue, the redraping of the skin, along with volume replacement, gives you a true rejuvenation of your face. I hope you've enjoyed this presentation. I've enjoyed using these new techniques and the new concepts of facial rejuvenation for my patients to achieve a very lasting and rewarding result. Thanks.